basically we had one who had left for a different job opportunity, and so there's one opening to keep them at minimal staffing.
All right, sounds pretty straightforward. All in favor of moving this to Wednesday, say aye.
Aye.
Anybody opposed? It moves forward. And then item B is I would entertain a motion to accept the grant award for Michigan Department of Corrections in the amount of $80,000 for the Community Corrections Advisory Board as presented.
Moved.
Support?
So this is a grant that we have been working on trying to get for a substantial period of time. Commissioner Webster has been working on it for several years now. We have finally received an award from the state of Michigan in the amount of $80,000, and we will be using that to implement pre-trial services, which will be related to individuals who are charged with felonies, and they will meet with a county employee, and this county employee will go through an assessment with them to determine what bail conditions should be. And this is very important in the wake of the bail reforms, and this is going to become required at some point. So with this additional funding, it will get us started, and we should be able to do it for that amount. Plus, this individual will also be doing some work with the Veterans Treatment Court, so that will make them whole.
Okay. Any questions or discussion for tonight?
Just one, so the 80,000, that's for salaries, that's,
More or less, there's salaries, some training, and then some computer software that they use in assessment.
So it's part-time.
Yeah, it's not a full.
It's a part-time salary.
80,000?
No.
It's not all for salary. You
Okay.
ask if it was for salaries.
Right.
It's for salaries plus some because it's only a part-time job.
Yeah.
So some other office cost and other tools that, assessment tools and
It's
those
about
sorts of things.
$50-some thousand worth of salaries and benefits.
Okay.
I'd like to say something, but I brought it up.
Go ahead.
No.
Don't make me the only one.
And the grant application actually was for a lot more than that, for other programs as well, which we kind of got an entry-level grant, and we'll hope to get some of those other things in place at a future point.
Correct.
We're gonna have to have somebody guide everybody now, like, in the court system, huh?
It's a different system than it was a few years ago.
All in favor of moving this to tomorrow night, say aye.
Aye.
Any opposed? And that moves forward, and that brings us to our last call to the public.
Watch the cord.
And I have a slip from Tom Mankey.
Let me ask the question here. This grant regarding the judge sets bonds and bails. He sets that. So is this going to be somebody who's going to be overseeing him or her, whatever the sex the judge is? So the judge no longer is going to have that authority. It's going to be some other bureaucrat.
Me. I can answer that, but I don't, that's okay.
Is that the end of your public comment?
So, yeah, if that's
I'm
the end
done.
of your comment, if you're done. So the answer to that question is no. The judge will still set the bail. Pretrial Services does a report that helps the judge determine what the bail should be. So they'll have a report about the person's background, their financial ability, different forms of assistance they may need in terms of housing and all what their situation is, to help the person be prepared for trial or for whatever the disposition is going to be, but also for the judge to have a complete picture of this person as they set bail. So bail will be set by that person. And I would also note that all of our judges are part of the Community Corrections Advisory Board. So they all have seen the grant, they all approved the grant, and so this is not a bureaucracy set up over against the judges. It's something to assist the judges, and they've all been part of creating it.
So in this, I don't know if you know the answer to this or not, but so what happens now? What do the judges, do they just wing it, or do they?
Magistrate is the one that sets those bonds, and they ask maybe a couple of questions, and then they make their determination.
So the magistrate in all cases?
I'm pretty sure it's the magistrate in most cases. I'm not sure which ones go to the judges versus the magistrate. Almost everything begins with him.
Okay. Yeah, I did not know that.
Almost everything begins with whoever the magistrate is.
Huh.
All right, thank you for your question. Anybody else care to address the board or the committee? Seeing none, I would entertain a motion to adjourn. Or I guess just adjourn.
Order and stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First call to the public. Seeing no one, we'll jump right into our agenda items. Agenda item A, I would look for a motion to approve the agreement between Mr. Agbanaya. I kind of remember this from last year. And the Shiawassee County Health Department for a period of 10/1/24 through 9/30/25, and authorize the board chair to execute the contract.
Can I abstain?
I hope not, because it's just me and you,
I
so.
thought anybody can abstain anytime the way things go around here. I'll make the motion.
So Gary made the motion, I'll support it. Gary?
Yeah, this is our epidemiologist. He's a contract employee, 20 hours a week. The rate is $41 per hour, and that's an increase of $1 per hour over last year's level. And we're fortunate to have him. Still, we originally got him during the pandemic, and he works remote primarily, doing disease investigation. So we're very fortunate to have him. And we left his first name off the agenda today, so it was a little bit easier to say. It's a mouthful. He's doing a good job for us.
$1 increase.
Yeah, wow. In this, that we're required to have this, correct?
Not required,
No.
but it's nice that we're able to have it. It's a luxury that the health department has never had before until we got Mr. Agbanaya. We never had an epidemiologist before, so some good came out of that terrible pandemic.
All right. Any further questions on this item? If not, all those in favor signify by saying aye. Aye.
Aye.
Those opposed, the same. Our next agenda item, I would look for a motion to approve the contract renewal with the Shiawassee Regional Education Service District for hearing and vision screening for an amount not to exceed $15,747, and authorize the board chair to execute that contract.
That's the hearing and vision screening for the preschool students. The various preschools, some of which are in daycare, some of which are in the school districts. And this RESD pays the health department to do those screenings. And it was, I think, a 5% increase over last year's contract amount. So that's good. We're trying to keep the contracts going with inflation.
I feel like I remember doing that as a kid in school. Like, so this is,
Hearing and vision was the thing, they always did like a little control board, they put a thing on your ears and the different
Oh,
color
yeah,
things, remember?
yep.
Might be a little more modern than that now, but we're.
I'm getting old.
Crazy. Okay, so Gary made that motion, I
No,
supported
I
it.
didn't, but I will now.
Thank you.
I'll make the motion.
I'll support it. Larry's already explained it to us. Do we have any other questions or memories from childhood? If not, all those in favor signify by saying aye.
Aye.
Aye. All those opposed, the same. next agenda item, I would look for a motion to approve the contract renewal with Shiawassee Health and Wellness for social work services as part of the Perry Schools Child and Adolescent Health Program in an amount not to exceed $86,258 and authorize the board chair to execute that contract.
I'll make the motion.
I will support it.
The next two contracts are with Health and Wellness for the social workers that we have in the school wellness programs. The nurses for the program are health department employees, but the social workers are contract employees that we get through Health and Wellness. And as luck would have it, Health and Wellness kept our rate at exactly the same as it was last year, no increase. So I was surprised by that, but I wasn't complaining. So it's the same amount that we paid last year. And that way, we don't carry the legacy costs for the employee, and the relationship has worked well up until this point, so we'd like to continue it.
Is this a special grant then?
Yeah,
Okay.
it's a school wellness grant. We originally had it in Durand, and then it expanded, and we were able to get one in Perry Public Schools.
So Larry, the social workers have an office in the school, correct? And do they function somewhat like a school counselor, or?
Yes, very similar to that. It's one of their roles. They're a little bit more advanced because they have clinical services that they can provide. You know, I can't quite delve into everything that they do, but
Right.
the mental health issue in schools is huge. It's gotten worse since the pandemic. So, and there's a shortage of social workers, as we know here at the county. So we're fortunate to be able to get qualified people from Health and Wellness because we're having difficulties trying to hire social workers ourselves. So we're going to try to keep that going as long as we can.
All right, any other questions for Larry on that item?
No, but this is somewhat similar. I was at Chronic Breakfast this morning, and they had all the schools in the county when they started COVID and how they improved to, you know, the schools that now, and Chronic was the only one that was up 50%. Most of them were below 2 or 3% or 5%, or someone was only up 2%. I was shocked. Someone
Yeah.
took a survey of all that, so it's kind of connected with the mental health and all the things that went on with the COVID, and now they're trying to get back up to standards, but they're having problems.
Yeah, it seems to have hit school-age children.
That was all, you give a report on all the, I didn't write them down, all the people in all the schools in the county. I thought it was very interesting, so. Learn something every day, so.
Yeah. All right, all those in favor, signify by saying aye. Aye. All those opposed, the same. Our next item, I would look for a motion to approve the contract renewal with Shiawassee Health and Wellness for social work services as part of the Durand School Wellness Program in an amount not to exceed $86,258 and authorize the board chair to execute this contract.
I'll make the motion.
I will support it.
Same thing.
This is just the Durand one.
All right, any questions on that? All those in favor signify by saying aye.
Aye.
All those opposed, the same. Our next item, I would look for a motion to approve the contract renewal with Convenient Urgent Care for Sexually Transmitted Infection Services and authorize the board chair to execute the contract.
I'll make the motion.
I'll support it.
This is a contract renewal for our STD program. The referrals go to Convenient Urgent Care, and the rate has remained the same for the last few years, so they did not increase the amount on us. So that's good news also.
So you refer, or the health department
They come in,
refers?
they meet with one of our nurses, but we don't have a clinical doctor or physician or nurse practitioner that can do the actual service in-house. And so they get referred out to Convenient Urgent Care to conduct the evaluation of the patient, the health assessment. And then we provide the medication if they're positive for STD.
Okay, and we're able to offer that free of charge?
Yes, the medication,
Yeah,
yeah.
okay.
We're trying to few other things that we've got going on.
I appreciate that. I just wondered, so the medication, you just keep it
We have,
in stock or however that works? Okay. Got anything, Gary, or?
No,
any
it's
other-
just with everything else, lucky it hasn't run up.
Right. All right, all those in favor signify by saying aye.
Aye.
All those opposed, the same. Our last item is, I would look for a motion to approve the contract with PMC for temporary nursing services and authorize the board chair to execute that contract.
I'll make the motion.
And I will support it.
This is a new contract, and it's a temporary contract, a 3-month contract. We have a nurse that's going out on maternity leave, and she's our immunization coordinator. And so she's leaving us at the busiest time of the year, and so we're going to bring in a temp to help out with staffing, to help get through the clinics and different things that we're doing. So we're going to try to get that person here before she leaves, because I think she's leaving around October 1st. So it's coming up pretty quick.
Okay, well, sounds like a good plan.
We've had a few go out on maternity leave this year, so.
And this one is the one that has to have a certification as a nurse, so
Yeah.
it's a little more difficult.
Right, so we can't just send somebody over. All right, any other questions or? All right, all those in favor signify by saying aye.
Aye.
All those opposed, the same. And that moves on to tomorrow night.
I won't be with you tomorrow because I've got to coach football.
All right, well, I think we covered any questions or concerns. All right, we are adjourned. Thank you.